Hello everyone, it's me again. We are going to talk about the tutor for the week 2 related oral drug calculation, tablet, capsules, syrups, and sublinguals. So let's begin with reviewing. So you need to have the right drugs or medicine, right dose, right patient, right route, right time, and right documentations as the 6 rights principle for drug administration. And let's begin with the tablet drug or oral drug. So the valid quotient for this is you have the required tablet. So you have the required dosage divided by the available dosage and multiply with the available tablet. So for example, here you have amlodipine tablet 5 milligrams. So this is what we call the available dose. Another example is if we are going to use like a syrup or with a tablet, then what you need the required dosage with the available dosage divided with the available dosage, and then you have the available volume, solvent or diluents. So as you can see here, this is the available dosage 120 milligram, and then this is the solvent or the syrup is 5 milliliter. Now, as we are going to also learn later on in your pediatric nursing classes, we will learn about the pediatric oral drug calculation. So, sometimes you have the rule that it's the age divided by age plus 12 multiply with the adult dose. So that will be the pediatric dose. Or you will have the weight and divide it by the 150 pound and then multiply with the adult dose. That will be the pediatric dose. And another one is you have the modified weight rule where you have the weight divided by 50 kilograms and multiply with the adult dose as the pediatric dose. And sometimes you also have the Fritz rule for infants younger than 2 years where you have the age and months divided by 150 and multiply with the adult dose equals with infant dose. Sometimes you also have the body surface area method where you have to calculate the surface area of the child and divide it with 1.73 square meter, multiply with adult dose, and that will be the pediatric dose. So these are always usable, but then you always have to check also with the required that coming from the pediatrician. Sometimes they ask like a few milligrams per body weight kilogram. So for example, like 10 milligrams for 1 kilogram of the baby's weight. Now, let's begin with the example questions so you understand it better. The first one is the doctor prescribed the medicine of paracetamol 500 milligram orally BD or twice a day for Mr. A. The available dosage of the medicine is paracetamol 500 milligram per tablet. And how many tablets should be taken by Mr. A at one time? So one time, so we have here, let's break it up. So the doctor prescribed paracetamol. So what we know, the required dosage is 500 milligrams. The available doses is 500 milligrams per tablet. And what's being asked is how many tablets should be taken at one time. Remember the basic formula is required tablets equal to required dosage divided by available dosage multiplied with available tablet. So you will have the required tablet 500 milligrams as the required dosage divided by the available dosage 500 milligrams and multiply with 1 tablet because that's the available tablet. So the required tablet that will be taken by Mr. A is 1 tablet. Okay, let's continue. Now, the doctor prescribed medicine of Panadol 1 gram orally BD to Mr. E. Available dosage of the Panadol is 500 milligram per tablet. And how many tablets should be taken by Mr. E per time? So as you can see here is the Panadol. Let's break it up. So you'll have the required dosage 1 gram here, and the available dosage is 500 milligram per tablet. How many tablets will be taken by Mr. E? So the answer will be, you have to convert first the 1 gram to 1000 milligram. Remember the one that we learned before? So you convert the gram to milligrams. So the basic formula stayed the same. Required dosage divided with available doses multiplied with available tablet. So you'll have 1000 milligram divided by 500 milligrams, the available dosage, and multiply with the tablet, one tablet. So it will be 2 tablets. So in one time of taking medications, Mr. E need to take 2 tablets of Panadol. Next question. So you have Mr. B. Prescription is sucralfate 3 times 1000 milligrams PO given AC before food. Available dosage of the medicine is shown in the picture. So this one, as you can see, 500 milligram over 5 milliliters. So how many cochlear tea or teaspoon should be given to Mr. B if 1 teaspoon is 5 milliliter in one given dose? Let's break it up. So the required dosage is 3 times 1000 milligram, and the available dosage is 500 milligram in 5 milliliters. So what you need to do, basic formula again the same, required dosage divided by available dosage multiply with the available volume. So what you need to do is 1000 milligrams divided with 500 milligrams multiply with 5 milliliters. Okay, that's the first step. So you have 10 milliliters as 1000 divided by 500 is 2, 2 times 5 is 10 milliliters. But then the question is, how many cochlear tea or teaspoon? So you need to count again. 1 teaspoon is 5 milliliter, and here we have 10. So 10 divided by 5 equals with 2 teaspoons. So Mr. B needs to take 2 teaspoons of sucralfate in one dose of his medication. Alright, move on. Question 4 is a child. Diagnosed with upper respiratory tract infection, and he's prescribed Mucopac 3 times 2.5 3 times a day. The brochure said it's 50 milliliters. So we want to know how many volumes of the Mucopac can be given in one day. So we want to calculate. Okay. Now, the prescribed dose here is 3 times 2.5. Okay. So 3 times 2.5, one a day. What is being asked? The volume that can be given in one day. Okay. So in one day it's TDS. So it means 3 times a day, 3 times 2.5 milliliter. The answer is 7.5 milliliters. Just ignore the one bottle is like 50 milliliter. It's just there, but it make no use. So just focus on what is being known, what is being asked, and what's the answer. Okay. Next question. This is a tablet. Cefixime tablet with a required dosage of 100 mg OD orally will be given to child T in therapeutic work. The available dosage for Cefixime is 200 mg a tablet. So how many tablets should be given to child T? Again, we break it down to required dosage, available dosage. Remember the basic formula, required tablet equals to required dosage divided available doses multiply with available tablet. Then we'll have it. So the question, the required doses is 100 mg OD. So we have 100 mg, and the available dosage is 200 mg a tablet. So 200 mg a tablet. Now, how many tablets should be given to child T? Because it's only one day, once a day. The answer will be the required tablet equals to required dosage 100 divided by 200 times 1 tablet. So it's only half of the tablet that will be given to child T in his medication. Alright, you ready? We have a few more to go. Let's do this. So another example, tablet of drugs. The doctor prescribed therapy of cetirizine HCl tablet PO 5 mg PRN when it's needed. If child P is complaining of itchiness, so how many tablets should be given to the patient if the available dose in the package 10 mg per tablet for one-time dosage? So let's break it up. So here you have the medication, right? You see it's like 10 milligram a tablet. So the required dosage is only 5 milligram, but available dosage is 10 milligram per tablet. So again, coming to the basic formula, required dosage divided with available dosage times available tablet, it means 5 milligrams divided by 10 milligrams times 1 tablet. So the child will receive only half tablet in one-time dosage for PRN when it's needed. Alright, you're doing great. Now, example 7, this is a sublingual tablet. You put it under the tongue. So it's ISDN or isosorbide dinitrate 5 milligram, okay, or what we call Sedocard. So this is given to Mrs. T. A required dosage is 10 mg BD sublingually. If the available dosage is 5 mg, how many tablets should be taken in one-time dosage? And if it's been taken 8 in the morning, what time will he take the next dosage? Okay, let's break it up. So the required dosage is 10 mg BD sublingually 2 times. The available dosage is 5 mg per tablet. So how many tablets required? It's 10 mg divided 5 mg times 1 tablet. So 10 divided 5, it will be then 2 tablets in one time. Okay. Now, we already know that he is going to have the tablet at 8 in the morning, right? What is being asked? What time is the next dosage? BD means every 12 hours. So now it's 8 a.m. We're going to give it again at 8 p.m. All right? Next question. Child E is hospitalized at RSUS with weight of 15 kilograms, having high fever. Pediatrician prescribed antipyretic paracetamol 10 milligrams per kilogram weight, or BB. The available dose is 120 milligram over 5 milliliters. So in 5 milliliters, we have 120 milligrams. If the child is 4 years old, how many dosage will then be taken to lower the fever? Kind of complicated, but let's break it up. So, what we know is the weight of the child is 15 kilograms, right? And the prescribed dose is 10 milligrams in 1 kilo of weight, okay? And then we have 120 milligrams over 5 milliliters here. Now, what we need to do is we look for the required, remember we still use the same formula, required dosage divided available dosage times the available volumes, tablet, or diluent, or solvent. So we need to see how many the required dosage here with the weight. So we have the child 15 kilograms. So we times 15 kilograms times 10 milligrams in one body weight. So we will need 15 times 10 means 150 milligram. That's the required dosage. So then we put into the formula 150 milligrams divided with 120 milligrams and then times 5 milliliters because it's 120 milligrams and 5 milliliters. So how many we are going to give? We are going to give 6.25 milliliter in a one time to the child 4 years old to lower the fever. Alright, next. Now the very last question, but it's a little bit different. Okay, so you have kind of the same, but then here the pediatrician only described 10 milliliters. Okay, so you're going to count on how many milligram dosage inside the 10 milliliter if 120 milligrams is given in 5 milliliters. So again, remember the basic formula and we read again the question. But then the pediatrician prescribed 10 milliliters, so the available dose is 120 milligrams over 5 milliliters. So now let's calculate. So the weight of the child is 15 kilograms. The prescribed dosage is 10 milliliters and the available dosage is 120 milligrams. Now we're going to look on how many milligrams is inside 10 milliliters. So you put into the formula the required tablet or required prescribed is 10 milliliters. We don't know how many milligrams, but we know it has 120 milligrams times 5 milliliter for the available dosage. So now we do the calculation. So we have 10 milliliters with 5x divided with 120. So we have the x as 240 milligrams. So well done. You have done the learning process for this session, Tutor Week 2. Feel free to ask questions on our session on site. God bless you.